when a patient dissociates, and remember, they will dissociate if you're working as a trauma therapist. Dissociation is something that you can anticipate that you will see every day in your office. When a patient dissociates, we need to decide what our toolkit is to respond to that, and we need a toolkit. Experts like my friend and colleague, Dr. Jamie Marich, has provided some really wonderful resources, and I recommend her most recent book to you. Dissociation, whenever we look at it, first of all, as therapists, we can't stop our patients dissociating. It's like trying to stop our patients sneezing. If something really irritates their respiratory tract, it's going to lead to a sneeze. For some of our clients, dissociation is a response that will come whenever we have those trauma networks being activated. But there are a couple of little tricks and tools that we as therapists can have. Let me give you two of mine. The first one is that we observe that whenever we ask people to undertake mental maths, that process of engaging in mental mathematics can be very effective in helping to ground a person when they are dissociating. The simplest one that I use is having the person work out the Fibonacci series. Fibonacci series is a numerical series that we see throughout nature, and it starts off with 0 and 1, and the next number in the series comes from adding the previous two numbers together. So 0, 1, 1, 2, etc. Now, it's important here that as a therapist, you're not a maths teacher, so this is not about correctness of the answer. It's simply that we're having the person go through that numerical sequence. But what we find is that as the person goes through that, we see them beginning to associate again, and you'll see the person begin to ground, which is good. Another tool which I utilize in practice is having the person do simple catch and throw. Now, this could be, I've done it with a box of tissues, or a soft toy, or a cushion. And what you would simply do is say to the person, look, okay, look at me, I'm going to just throw you this cushion, just catch it and throw it back to me. And by that act of throwing and catching, again, we see the person begin to ground. These are two tools that I hope that you can maybe try with your clients if you see them beginning to dissociate, and I'd be interested to hear how you get on with those.